COVID-19, the distinction between the case fatality rate, CFR, and the infection fatality rate, IFR. May 27th, 2020. So this is just a short video on the surprisingly confusing but critical distinction between the case fatality rate, CFR, and the infection fatality rate. Now these are different numbers that mean different things. They are often confused in the discussion of the COVID-19 crisis. I want to be clear here, and this is intended as a very short description of the difference between the two. There are subtleties which I'm not going to go into. The case fatality rate, or CFR, is the number of deaths attributed to the disease, usually among those diagnosed with the disease, divided by the number of diagnosed cases, according to some diagnostic criterion, for example, a positive reverse transcriptase polymerase chain reaction test. Now there's a lot kind of hidden in there that I'm not going to go into, but what's critical to understand is that one is dividing by the number of diagnosed cases. So these are generally people who go to a doctor, go to a hospital emergency room, or are close associates of someone who was sick who are tracked down through contact tracing. Those people are tested in some way, which could be very subjective. It could be just asking them what symptoms they have and saying, well, you know somebody who has COVID, so maybe it's you. That may happen in some nursing home settings or other settings. Usually people are talking about these RT-PCR tests, at least according to the news coverage. Again, the case fatality rate is the number of deaths divided by the number of diagnosed cases. It depends on actually diagnosing a case. And that tends to be people who are at high risk, people who have symptoms, people who go to emergency rooms or call their doctor or have serious problems. On the other hand, the infection fatality rate, or IFR, which is also sometimes called the actual mortality rate or lethality. The IFR is the number of deaths attributed to the disease divided by the actual number of people infected, which generally includes mild or asymptomatic infections which are not diagnosed. So there's a real difference here between diagnosed and undiagnosed. Most diseases, most respiratory diseases in particular, have many mild or asymptomatic infections. That's not unusual, and it's the case for the coronavirus SARS-CoV-2 virus, although early in the crisis, there were apparently claims that there were no asymptomatic or mild cases happening. That's not true, and it's clear it's not true, and it would be very unusual if it was true. The case fatality rate, or CFR, generally reflects those with more serious infections who seek medical attention, go to a hospital emergency room, etc. It is generally biased, usually higher than the infection fatality rate for most diseases. It can also vary a lot depending on the availability of tests, which has been a major issue so far in the crisis, and on other causes unrelated to the genuine lethality of the disease. Just the policies of whether, remember, people are being asked to just stay home and not go to the hospital if they have a mild case, so they may never show up in the statistics. Again, it's really important to understand these numbers can be very, very different. A disease that kills everyone who exhibits symptoms and no one who has no symptoms, even though actually infected, can have a case fatality rate of 100%, which would be very scary, far beyond what's been reported for the coronavirus. Yet, its infection fatality rate could be nearly 0%. Let me say that again. A disease that kills everyone who exhibits the symptoms and no one who fails to exhibit the symptoms, even though they're infected, can have a case fatality rate of 100% and an infection fatality rate of almost nothing, 0%. An example, an exotic disease that produces distinctive green and purple spots in those it kills, easily identifiable even without advanced tests like RT-PCR. But in fact, it only kills 100 people in the United States out of a population of 330 million, even though for some reason, it got into the food supply or the water supply or something happened and almost everyone is infected. Nonetheless, it doesn't actually kill anybody. I mean, I should say it kills almost nobody. Those people who are killed by it, because it's very unusual and easy to identify, uh, the case fatality rate for that disease would be 100%. Everyone that has the exotic green and purple spots is obviously sick and they all die. But if your immune system is able to deal with it, which is true for the vast majority of people, in this example, you don't get the green and purple spots and you don't die. You don't even exhibit any real symptoms. Thus, the case fatality rate can be huge. It can be 100%, and yet the infection fatality rate can be 0. Generally, the infection fatality rate is lower than the case fatality rates reported. That's nothing new. It didn't start with the coronavirus. That's the way things work. It just reflects the fact that people who are seriously sick go see doctors and ask for help, whereas people who are asymptomatic or have a mild case of a disease may just stay home and ride it out, may not even realize they're sick or think they have something pretty minor. Although there are a number of subtleties in the definition and computation of these numbers that I've omitted for clarity, the infection fatality rate, IFR, ideally broken down by age, medical conditions, and other risk factors, is key to evaluating the proper public health response to an outbreak of an infectious disease, not the case fatality rate, or CFR, which can be very misleading. This concludes this video presentation. If you like this video, please click like. Please click subscribe and the notification bell if you would like to receive more content from us. You can avoid internet censorship by subscribing directly to our RSS news feed. Please consider sharing the link by email or on your website or blog, in addition to liking, upvoting, or sharing on increasingly censored, advertising beholden, and big company social media. We have encountered such censorship. Mathematical Software is developing software to automate data analysis, reducing the risks of costly errors and improving results. You can support our work financially by subscribing on our Patreon page. Scan the QR code in the lower right corner to get the Patreon link. Our Patreon link is also in the show notes below.